Hi, Dr. Sassy here from the Continence Center. So who really is the perfect candidate for sacral neuromodulation to treat bowel and bladder continence problems? Let me try to define that a little bit, because the sacral neuromodulation has been such a great technology. It's been really a breakthrough technology, and the FDA has approved it for what they call its indications, meaning the specific conditions for which it is approved. And those are urinary incontinence, bowel or fecal incontinence, and overactive bladder. So that's a good starting place for who's the perfect candidate. I would say that anyone who is struggling with those problems, who's having bladder leakage, who's having overactive bladder symptoms, for example, making them get up in the middle of the night multiple times, certainly someone who's having to wear a liner, pad, or diaper, and certainly anyone with bowel leakage or fecal incontinence, there's a really good chance that sacral neuromodulation is going to help a great deal. There are controversial areas where sacral neuromodulation in our center and in increasing number of published reports worldwide is showing itself to be very effective in treating conditions that are sort of at the margins of those three primary FDA indications. It may take some time, but I strongly suspect we're going to see expansion of the indications for sacral neuromodulation as the appreciation grows for how effective this can be. Keep in mind that our strategies for dealing with this type of pelvic floor disorder, the bowel and bladder control problems and regulatory problems involving this complex set of nerves and muscles, historically has been either surgical, where we as surgeons go in, we suture muscles together, we place meshes or slings or other materials, or we try to do something that we think can try to restore function of the bowel and bladder mechanisms and sphincters. You know, it really has to be said with all honesty that those strategies have been pretty mediocre. They've not been terribly successful. Plus, surgery is somewhat invasive no matter what the technique. Likewise, the other main strategy, which has been medications, has also not been very successful at all. We have a couple of classes of related overlapping medications which have mechanisms that tend to create some improvement, primarily in bladder control. But as we've learned, they also come at the expense of some side effects of dry mouth, but also affecting memory. So the main class of medications has been determined to not be advisable by AARP as well as other advisory societies, despite the fact that tens of millions of these prescriptions are written every year. So the medical strategy has been not very effective, but also fraught with side effects. The surgical strategy has also been mediocre effectiveness, but more invasive. Using exercise alone, biofeedback, and physical training, physical therapy, Kegels, and more sophisticated pelvic floor therapy has offered some success, but this is generally pretty moderate and has, in our experience, worked for people with fairly early symptoms, not really solving the problem for people who are wearing diapers every day and having accidents on a daily basis or weekly basis. So what has been really successful has been this strategy that is somewhere in the middle of all that, which switches on the body's natural nerves and muscles and uses a technology that has been refined over the last 25 years or so, and that's modulating the body's own nerves to communicate to the body's own muscles to do their own job with your own natural tissues, and not something supplied by me as a surgeon or modified by a daily medication dose. That strategy has been remarkably successful. I would also argue that it's remarkably non-invasive, taking place with some needle pokes and a little tiny incision to slip the ultimate little computer chip under the skin. Nothing like doing the invasive surgery that we sometimes have to perform, and certainly nothing that requires an ongoing treatment with daily oral medications that have those side effects. So I would say sacral neuromodulation has emerged to treat this host of conditions in a way that is safer, simpler, less invasive than the existing strategies. And so that's why there are actually a lot of people who really are the perfect candidate for this procedure, given the 90% effectiveness of the technology and the low invasiveness, low side effect profile of the technology, and really low cost too when you consider the long-term costs of taking medications over time. So I would say you're likely a perfect candidate if on the bowel side you've been struggling with having leakage, seepage, accidents, and it is just not resolved despite trying to do some Kegel exercises at home or taking fiber and altering your diet in a way that can make the stool consistency more regular and more solid, that despite that you're still getting leakage or accidents, then you're a perfect candidate to at least consider sacral neuromodulation and talk to an expert about it. Likewise, on the bladder side, if you're having either the bladder incontinence leakage problem or overactive bladder symptoms, you're likely a perfect candidate to at least explore it and talk to an expert about it. There are some sort of splitting of hairs or fine-tuning that we in the medical world like to do with respect to bladder incontinence. Whether it's more of a stress type incontinence, meaning that it's only when you cough or sneeze or exert some pressure, or whether it's more urge incontinence. And there is some literature saying that the stress incontinence may be better served with surgical sling procedure in some cases or medications. Our experience has actually been that sacral neuromodulation is highly effective for stress incontinence, and you're starting to see more and more literature about that. But that remains a somewhat controversial idea that's not fully and widely accepted. But for most people, they have already tried many of the above therapies and they're still having significant bladder leakage, in which case they are indeed perfect candidates for sacral neuromodulation. A very high fraction of our patient population, for example, has already had a bladder sling and it has failed. They have already tried medications to restore bladder control. Those have already failed, and they have already done biofeedback or pelvic floor exercise therapies, and those have not solved the problem. They don't hurt, but they don't solve the problem. And so someone like that is clearly a perfect candidate for sacral neuromodulation. And despite all those other therapies not having worked, this therapy works 90% of the time with a 20-minute procedure and a couple little Band-Aids. So I would say the range of folks who really are the perfect candidate is a lot wider than most people and even most clinicians would imagine, especially given the low invasiveness and the high success rate. So I would say if you're kind of not sure about it, err on the side of finding a specialist who really knows about this technology and go see them. Keep in mind that the first step is really just a test or a trial. In the vast majority of cases, the first test or trial step is done where we assess whether your body is a good candidate for it, doing some testing in a trial procedure, typically in the operating room, but in a short 20-minute fashion we can gain a lot of information as our computer interacts with your nerves and muscles, and then you go home with a trial device so you can kind of try it out at home. And based on that trial period of a few days to a week, most people can really tell that the technology is going to work for them and really solve this frustrating, embarrassing, annoying, dreadful problem of bowel and bladder leakage or overactive bladder. So I hope that gives you a sense. The odds are that if you meet any of those above criteria, that you really are the perfect candidate for it. So I'd advise you to go seek that expert, go check it out, and then at least do the trial or the test to kind of understand even better if your body is a good candidate for it. Because the results for most people are so good that it really restores their quality of life and ability to get out and interact in life and do those things that make life worth living. So I hope that's been helpful. I wish you all the best.